You may have pain in the heel that is worse when you first step in the morning after you wake up. This condition can be caused by plantar fasciitis. In this video, I'm going to talk about the characteristic of the symptoms so that you can self-diagnose, and also what you can do yourself to get better if you are suffering from plantar fasciitis. Stay tuned. My name is Dr. Tony Setiobudi, an orthopedic and spine surgeon at Mount Elizabeth Hospital, Singapore. Before I talk about plantar fasciitis, I want to explain what is the meaning of plantar fascia. Plantar fascia is a strong band like a ligament at the bottom of the foot. This is the plantar fascia. One of the functions of plantar fascia is to keep the foot arched. And if we tilt it sideways, you can see the plantar fascia is acting like a string in a bow. So this is the string and the foot is the bow. You can suffer from plantar fasciitis if you do a lot of activities that is stretching the plantar fascia beyond what it can take. This can cause a tear at the origin of the plantar fascia, and also it can cause inflammation. There are a number of risk factors that make us prone to have plantar fasciitis. Number one is age. Plantar fasciitis often occurs between the age of 40 to 60. Number two, certain types of exercises cause a lot of strain in the plantar fascia. For example, long distance running, ballet, or dancing. These activities cause a lot of stresses or strain to the plantar fascia. Number three, foot abnormalities such as flat foot or high arch. So people with flat foot or high arch often get plantar fasciitis. The next one is obesity. Our weight put a lot of pressure in the lower limbs, including the foot and plantar fascia. So the heavier the weight, the higher the pressure to the plantar fascia. The last one is prolonged standing or walking. Any occupations that require the person to stand or walk too long, including teaching or factory worker, can predispose the person to plantar fasciitis. The symptoms is typically a stabbing pain at the bottom of the heel. It is worse after prolonged inactivity, such as in the morning when we wake up from sleep. The first step is the most painful. Sometimes if we need to sit for too long, the first step after sitting is also very painful, and as we walk more, the pain can ease off. That is the typical symptoms of plantar fasciitis. Plantar fasciitis can be diagnosed based on the patient's symptoms and the physical examination. In the plain X-ray, we often see a bone spur arising from the heel. The MRI scan can reveal the severity of the inflammation and also can pick up if there is a tear in the plantar fascia. So, what can you do yourself to improve if you have plantar fasciitis? Number one, check your shoes. If your shoes is hard, you may want to have a heel cup or cushion. Or you may want to change your shoes to a sport shoes that is more comfortable. Number two, you can do stretching of the plantar fascia as shown here. The next one is anti-inflammatory cream. You can use the cream to put in the painful area twice a day. This is to reduce the inflammation. If you have a tennis ball or a bottle filled with warm water, you can roll your foot on the tennis ball or the warm bottle. You can try these simple steps, and I hope you do get better from plantar fasciitis. I hope this information is useful to all of you, and thank you so much for subscribing, liking and sharing my video, and also thank you for listening, and I hope to see you again in my next video. Bye bye.